At AARP Missouri, we want to support you as you age. But first, you should learn a little more about us. AARP is a nonprofit organization working to help adults 50 plus in Missouri live their lives to the fullest. We advocate for over 700,000 members on important issues such as strengthening Social Security, protecting access to health care, and ensuring everyone has independence and choice as they age. AARP Missouri also offers online tools, resources, and programs you can access right from the comfort of your home. Learn how to protect yourself from fraud and scams with the AARP Fraud Watch Network. Become an active part of AARP Missouri as a virtual volunteer. Find support while caring for a loved one through our caregiving resources. And enjoy a variety of fun virtual events that improve your health and wellness, like our exercise series, Moving It. At AARP Missouri, there's an entire community waiting for you. Learn more about us at aarp.org/mo.
Hello, I'm Diane Hall from AARP Missouri, and if you haven't heard yet, it's National Caregiver Month. This is our second conversation about caregiving this month with AARP's National Family and Caregiving expert, Amy Goyer. Amy, thank you for joining us again.
Thanks for having me. This is one of the most fun parts of my job, that I get to work with you in the state AARP state offices. Thanks for all you're doing, Diane.
Well, we appreciate you, and as ever, we're happy to have you with us because AARP is committed to connecting caregivers to resources and services that they need, whether it's how to find time for yourself as a caregiver, local and national resources for caregivers, or just a way to check in with caregivers for support and tips. And Amy has a depth and breadth of firsthand experience as a caregiver and is plugged into all kinds of resources and supports for caregivers. And today we're going to learn about some of the resources for caregivers, not just from AARP, but also from other organizations, as well as some legislation that can help caregivers. Now, Amy, last time we talked, you shared some of your experience as a caregiver in our first chat, but could you share a little more about your caregiving journey for people who might not have been on last time?
Yeah, so I first became a caregiver when I was about 20 in college for my grandparents, who lived one state over, but my parents had moved across the country, and my dad was an only child, and my grandmother had Alzheimer's. So, of course, that was some intensive caregiving for my grandfather, and I helped a lot getting them in-home services and that sort of thing. And my mom had a stroke, and my dad became her primary caregiver, as well as dealing with his parents long distance. And my sisters and I started helping out with my mom and making sure she got into good rehab and all those sorts of things. Later on, my dad developed Alzheimer's disease, like his mom had. And that was a long haul. I started getting more involved in helping my dad manage kind of the details of financial matters. That was the first thing that he really started struggling with. He would get stressed out, and I can remember him coming into his office, actually the desk that I'm sitting at right now, and trying to go through the mail and organize things. And he'd put Post-it notes on the top of stacks that said, "Ask Amy, ask Amy." So I asked him, would you like me to help you with some of this financial stuff? Because I know it can be stressful. And I knew that having Alzheimer's, stress was the last thing he needed, because that, he needed to manage his stress in order to keep minimizing the progression of the disease and minimize the symptoms. So I started doing that first, helping him with organize for taxes, helping him open a checking account that was just for his spending money. And he put me on all his checking accounts. And then I would pay the bills out of the one account and then put money in his spending account every month. And he could manage that at first for about 3 years. And that was just a way to help him to be as independent as possible for as long as possible. So it was a lot about gradually increasing support, and especially in this whole issue of financial matters, so that he felt like he had some control over his life and taking care of my mom and those sorts of things. Over time, eventually, I took over managing all of their financial matters. And that was, stressful and really intensive. But I was so glad to be able to help them. It did affect my finances. I actually ended up in bankruptcy after more than a decade of caring for both my parents and my oldest sister, as well as a long distance caregiver for her. And then she passed away, and I managed her estate. So it was, I've learned a lot about the financial matters and the resources that can be helpful over time.
Well, and it sounds like, we've talked about the finances kind of in our first chat, but that bleeds over into the resources. And you were a true family caregiver. You didn't just care for one loved one or two loved ones, multiple people in your family, some of them long distance. And I think it has different needs and conditions that you had to work with. The financial impact of this, not just on doing the care, but on having to go back and forth and all that kind of stuff. My apologies. One of my devices is going off there.
That's what happens to all of us when we're doing all this stuff during the pandemic. We all started doing our work from home, and that happened to me once my Alexa started talking.
I hate when that happened.
We all get it, Diane, right?
It's always something, right? The kinds of things that you were doing as a caregiver, it impacted your finances, but you also found resources that would help you manage some of that stuff. Can you talk a little bit about what kind of resources you found helpful and how much they cost, or did they add to your associated cost or cut down? Talk a little bit about that, if you would.
Yeah. So one of the tougher things is the financial aspect of caregiving, because you end up paying for things out of pocket yourself that your loved one's budget won't cover. And, my parents had long-term care insurance. My dad was a college professor. He had pensions. He had Social Security. My mom had Social Security, and they had long-term care insurance. And then I got him VA benefits. And even with all of that, because dementia in particular is such a long haul and so intensive, at the end of his life, the last couple of years, he needed 2 people to be, when he was up and around, to be walking with him and everything. And I was determined to keep him mobile, which I think gave him a much better quality of life through right up until the last day of his life. And, but the costs add up. And I covered things that their budget wouldn't cover. And in fact, in a recent AARP study in 2021, 8 out of 10 family caregivers are like me. They incur out-of-pocket costs for caregiving. And the average annual amount that people spend is about $7,000, which I mentioned in our last video, which is an average. So I spend a lot more than that. Some people spend less, but that's a huge chunk of anyone's budget. Huge. And it can be a devastating chunk of anyone's budget. So, and Hispanic, Latino, and African-American family caregivers tend to have even greater financial strain. So, one of the things that was hard for me was I was not able to get any kind of a tax write-off for my support from my parents. But AARP is endorsing a bill that would at least have given me a tax credit that would have been helpful. If this bill passes, it's going to be up to a $5,000 credit for eligible working family caregivers. So people who are working, it's going to help you keep working. About 6 out of 10 family caregivers are working. So, and this tax credit really could be a huge help if you're paying for respite care and technology or adult daycare or home modifications. I did a huge modification of our bathroom to make it safer for my dad. All of those things would have counted, and that would have been really helpful for me. So I urge you to contact your members of Congress and tell them it's important to you that they pass the Credit for Caring Act. That's one resource that you need to talk to a tax accountant, make sure you're getting any benefits that you can and that they are. Another thing that's important is the actually kind of calculating your loved one's costs, but also what your costs are. What, as Diane knows, I moved across the country to take care of my parents, but I kept up a home in the DC area because my work was based there and I had to go back there very frequently. So that was a lot of expense for me. I quit my job, so I had to I had to get my own health insurance, and that's expensive. And in fact, Diane, hasn't AARP Missouri passed a Medicaid expansion law that might be helpful to caregivers like me who had to quit their jobs?
Absolutely. We passed Medicaid expansion, and it's going to allow for nearly 20,000 family caregivers who had to leave their jobs to care for their loved ones to go ahead and get health coverage, which they would not be able to afford otherwise. So it's really important as a caregiver, as you can, or someone who knows how important caregiving is, to get involved and advocate for the things that are going to help caregivers. It's a really critical part of caregiving is the financial part and finding those resources. So other resources that you found, Amy, that were helpful for you specifically in your caregiving journey that might be helpful for others to know about?
Yeah. So, I mentioned looking at our own expenses as the family caregiver, but looking at your loved one's expenses, understanding how much it's going to cost over time can be really helpful. And AARP is a wonderful long-term care cost calculator. And you can use this calculator to put in, okay, if they're living at home, how much over time is this going to be? If they're in a nursing facility, how much will it cost? Adult daycare, the different options for long-term care and how much that will cost. So I urge you to check out the AARP long-term care cost calculator. Another great resource that AARP has is the AARP financial workbook for caregivers. And that's at aarp.org/caregiver money. And there's a veteran and military version of this workbook if you're caring for a veteran or a military service member, and that's at aarp.org/VMF caregiver money. And this workbook was written by primarily a woman who is a caregiver. She's cared for her husband who has had a injury in Afghanistan, and she also is a tax professional. She's a financial professional, so she brings the personal and the professional to this workbook. I think it can be really helpful, again, to make sure you're covering everything and make sure you're getting the benefits that your loved ones might be able to get to help pay for the care, to actual care provision that might be eligible from the VA and other sources. So I urge you to get the AARP financial workbook for caregivers. I mentioned the VA. So the Veterans Affairs can be an enormous help. It was a huge help for my dad, who was a veteran of World War II and the Korean War. And I eventually got him healthcare benefits, which covered home-based primary care, which was a game changer for us. The nurse, everybody came to the house. It was all paid for. We got medical equipment and incontinence supplies and all his medications, almost all his medications, and ramps, and and they managed hospice care for him when he went into hospice care. So it was a huge help, but it can be overwhelming to try and figure out the VA. So AARP has created a new resource. It's the AARP Veterans and Military Family Caregiver Health Care Benefits. I'm sorry, I'm going to say that again. AARP Veterans and Military Family Health Care Benefits Navigator. Okay. It's a mouthful, but it's the healthcare benefits navigator. Think of it that way. And if you are a veteran, or if you're caring for a loved one who's a veteran, you can go to aarp.org/vets health navigator, and it walks you through the steps of eligibility for veterans healthcare and what it can offer, the various aspects of it. Urge you to check on that. And in addition, Veterans Affairs has a caregiver support program, and that's just at caregiver.va.gov. Caregiver.va.gov. That's the Veterans Caregiver Support Program. And from there you can learn about what resources are available, what supports are there for caregivers, and what supports are there for your veterans as well. And again, make sure you find out if your loved ones have long-term care insurance. Now, the other thing, Diane, and I know you're familiar with this from your own personal family caregiving and from your work, that there are a lot of home and community-based services available. Many of us care for loved ones who live in facilities. I've done that as well. But if they're living at home, There are so many more resources available now that can make it possible for someone to stay in their home. When I was caring for my grandparents back in the late 80s and early 90s, there wasn't that much available. Much more available now. And the best thing to do is to contact your area agency on aging and say, here's my situation. Can I get an assessment? What's being offered in my area? Is there home care? Is there respite care? Is there chore services and housekeeping and meals and adult daycare? What are the various things that can be available in my area? And you can find your area agency on aging by going to the Eldercare Locator. And the website address for that is eldercare.acl.gov. So be sure and check that. And then the last one I want to tell you about is the Community Resource Finder. And this is a tool that AARP has developed with the Alzheimer's Association, although it's got all kinds of resources, not just for people with dementia. And it's at aarp.org/CRF. That stands for Community Resource Finder. And then you can put in your zip code and find agencies and organizations and medical care and housing options and all kinds of things in your area that are going to be helpful through your caregiving journey.
Absolutely. And I want to go back just a little bit because you were talking about the Veterans and Military Family Healthcare Benefits Navigator.
Yes.
That is definitely it's definitely a mouthful. It's definitely online. But we also have some hard copies in the Missouri State Office if someone would like to have a hard copy of it, because some folks still like the hard copy thing. So you're welcome to contact AARP Missouri, and we will be happy to send you one. The other thing that we have going on is we have a state caregiving guide for Missouri that has some Missouri-specific resources, and it'll have the area agency on aging and county resources and toll-free numbers and those kind of things that you can call, so that we can make sure that connect you with the resources that are available where you are. Sorry, we lost Amy for there just a second. This is going to be our technical challenging conversation. That's all right.
Yeah, it's fine.
Because it's like real life and it's like caregiving. You kind of have to roll with how it happens and deal with it and move on. And there are resources.
That's exactly right. This is a microcosm. This is an example of the caregiving thing. You never know what's going to come at you when you're a family caregiver. Isn't that true?
It's absolutely true. And you look for the best solution that you can find, and you do the best that you can and find support where you can get it. And we really appreciate that you have all these resources and supports for us. And we're kind of running out of time in just a little bit, Amy. So any closing thoughts about how caregivers can find resources and financial resources specifically, but anything that you would care to share?
Yeah, it can be really overwhelming. So I urge you to try and pick it apart one thing at a time, address healthcare costs first, housing, look at all the financial pictures. Again, get help. There's no reason that you have to go through this alone. I know there were many times I felt alone, and I was physically alone in this caregiving journey, but I always knew there was support out there, and that's what you need to make sure and access. So never assume that your loved one is eligible or is not eligible for any kind of a benefit or service. Always ask, find out, keep asking questions, and take advantage of those resources that are eligible for, especially if it's going to help with the financial aspects, and resources that you might be eligible for that can help you manage your life better as well.
Absolutely. And I wanted to stick it up there, although we didn't quite have time to talk about it. There's a family caregiver discussion group on Facebook that is an awesome resource for that support and any of those kind of questions. So I urge you to look at that. And I will be putting all of the kinds of links that we've talked about in the description for this video, so you'll be able to find those easily without having to scroll back through all this. But before we go, Amy, thank you so much for sharing your time and information about caregiving. We do look forward to our next chat, where we're going to talk about some of Amy's top tips for home caregivers. In the meantime, please visit aarp.org/caregiving for more information and resources. And don't forget, AARP Missouri has that online family caregiver resource guide at aarp.org/Missouri Caregiver Resources, and Missouri is MO abbreviated. Thanks to you, our viewers, for joining us to learn about caregiving, and please share this video and information with others who might need it. If you'd like more information for caregivers or to connect with other AARP information or fun, you can go to aarp.org/near-you. Don't forget to like AARP Missouri's Facebook page and subscribe to our YouTube channel. Thank you for watching. We'll see you next time.